By now, everyone has heard of and or been infected by COVID-19 virus. It has affected us, our families, our society, and the world. As veterinarians, we are also concerned with how it affects our companion animals, as well as farm and wildlife species. First, it might be helpful to define a few terms. Pandemic. Pandemic occurs when an infectious agent causes widespread disease and death in a population. It's the worst kind of epidemic. If it's not as serious, it's called endemic, like the flu or a cold. Rarely a disease can be eradicated or completely removed from Earth, like smallpox has been. So far, most diseases become endemic if the disease-causing organism is not present. And an area, then quarantines might be employed to prevent it from entering or spreading. For example, Hawaii has no rabies virus, so there are strict procedures to prevent it from entering that state. Infection means that it occurs when the infectious agent enters the body of a susceptible host. Not all infectious cause disease. Only a susceptible host become infected, but not all infected hosts spread infection. It is possible to have no symptoms and spread the infection to others, or to develop immunity or eliminate the infection. The term disease mean results when infectious agent damages enough cells and organs to produce specific symptoms corresponding to the damage, like coughing, diarrhea, general symptoms such as fever and muscle aches. Immunity means that it's the ability of the host to attack and remove infectious agent. Immunity can occur naturally from the infection itself or by vaccination. These principles are the same for every infectious disease and all species. Today, we are only discussing COVID-19 and other species that might be infected by COVID-19 virus. What animals are susceptible to COVID-19? People are the natural susceptible host for this particular strain of coronavirus, which is spread primarily from the breath of infected people directly to nearby animals or people, and can sometimes be found in feces. To date, COVID-19 infection has been detected in pets, like cats, dogs, ferrets. According to the CDC's publication, it has also been found in big cats, lions and tigers, otters, gorillas, pintarang, coatimundi, a fishing cat, hyenas, and mink in farms. Of these, only mink seem potentially able to transmit it to people. Beavers and white-tailed deer in several US states have also been found to be infected. COVID-19 can be introduced to other species experimentally, including mice, voles, pigs, cattle, poultry, skunks, and hamsters. But they don't get infected or cannot spread it, or only spread to others if of the same species. The good news is COVID-19 does not appear to be zoonotic. That is to say that it does not transmit from animals to people. Only people and maybe mink seem to be able to infect people. So far, however, each mutant has its own property and infectious capability, and testing is limited. So this list is just the beginning. Unfortunately, COVID-19 infection is believed to spread from infected people to animals. As a precaution, if you have been diagnosed or have symptoms of COVID-19, it is recommended that you isolate from your pet, dog, cat, ferret, until the symptoms are gone. If your pet requires veterinary care for any reason and you have symptoms of COVID-19 or tested to COVID-19, it is recommended to ask someone who is not sick to bring your pet to the veterinarian. While your pet does not seem to spread the infection, Sick people can. We want to protect our staff and the animals that are in our care. Remember, there is no evidence to suggest that the pet can spread COVID-19 to people. It's the other way around. Your veterinarian will want to diagnose the problem before treating. Do monitor your pet for symptoms such as any respiratory signs like coughing, sneezing, fever, diarrhea, vomiting, and call your veterinarian if they are severe and if your pet is not eating or acts lethargic or sick. Do not bathe them or treat them with disinfectant or use any chemicals on them. Do not put masks or anything else over their face. Do not hold them or snuggle with them. Do keep your cats indoors. They can infect other cats. Think about protecting service animals. Large crowds indoors present a higher risk to your dog. Do contact a veterinarian for more specific advice. Routine testing for pets for COVID-19 by your veterinarian is not recommended at this time. Public health official will determine if or when testing should be done. Additional information can be found at cdc.gov, usda.gov, and from your veterinarian, who receives an updated information from the government and professional organizations in order to provide you with the most current recommendations for your pets. Pet Harmony wants you and your pets to stay healthy. For more tips, tricks, and valuable information on how you can best take care of your pets at home, visit us online and social media at petharmonyab.com. Thank you.